So you were progressing well. Squats felt good, step-ups felt good, and then suddenly, sharp pain in front of your knee. Now even the exercise you were doing last week feel impossible. If that's you, don't panic. It's extremely common in ACL rehab. It does not automatically mean you've damaged your graft. This is called anterior knee pain. Knee pain at the front of your knee. It's often linked to your patella, your kneecap, your patellar tendon, the tendon that holds your kneecap in place. It's especially common in patellar tendon grafts where the tendon itself is used to reconstruct the ACL. But it can also happen in hamstring grafts, or Achilles grafts, or in quad grafts. After ACL surgery, your quad essentially turns off and becomes really weak really quickly. And when the quad's weak, which is what does this, the kneecap doesn't glide very well, but it could be slightly off center. You should be doing this, moving smoothly up and down that groove inside the knee, but it could be slightly off track, which means every time you bend your knee, it's rubbing on the bones and structures underneath. And that causes irritation and pain at the front of your knee. But don't worry, it's usually a strength problem, not a damage problem. It might feel like it's just appeared out of nowhere. You increase load, you squat deeper, you add new exercises in like leg press, or you increase your volume. And your knee says, I'm not ready for this yet. And that's because the pain's often load related, range related, and it's not ready for the full range of movement that you've put it through, or even volume related. And it tends to appear, disappear, settle down a little bit, and then reappear, what feels randomly. It's really common, I see it all the time, and it definitely doesn't mean you failed. Nothing's gone wrong, it's just a minor little setback, a little hurdle for you to jump over on your way to full fitness. So what should you do? Let's go through it. One thing you should definitely not do is push through the sharp pain. The pain is there as a signal to tell you that something's not quite right. And if you push through that, you risk causing further damage. But also don't fully shut down rehab. Just because you have a little hurdle doesn't mean you suddenly stop and the world's about to end. There's things we can do and adapt slightly to get you through it. Identifying things that aggravate it is really helpful at this stage. Things like reducing the depth of your squats, reducing the load, so making the weight a little bit lighter, shorten the range, so do half squats, working in sort of a pain-free range. If you squat down to there and it's painful, but you're okay to here, then just do squats in this range. Or lower the volume. So quite simply, don't do as many. You should be focusing on calming it down, not shutting it down. I spoke about the VMO in previous exercises and how it's really important in knee stability, especially when it comes to your patella. But the problem with the VMO, which is the little teardrop muscle that sits on the inside of your knee, is that it switches off really easily. If its main job is to keep this kneecap in the right place so that when you are bending and straightening your leg, the kneecap's not rubbing. If the VMO isn't doing its job and it's not keeping it straight and stable, then that's going to cause irritation and inflammation underneath the kneecap where it's rubbing against the other structures. So some good exercises you can do to target the VMO specifically are things like terminal knee extensions, quad sets, especially with your toes turned out slightly, controlled knee extensions, and isometric contractions, which is where you hold the position for a period of time in pain-free ranges. Control is really important here. It doesn't matter how much weight you can lift, doesn't matter how many reps you can do. Concentrate on keeping things controlled because that's the only way you're going to make progress at this point. And it's going to help you prevent aggravating your problem. Look at it this way. Anterior knee pain is essentially your body letting you know that it needs to build some baseline strength before you progress. How long is it going to last? Everybody's symptoms vary. Everyone's ACL journey is different. It can last for as little as a few days. It can last for months. And it often fluctuates. So it might be there for a week, might disappear for a couple of weeks, and then it comes back for another month. But it improves with targeted strength and tackling the root cause. There's no point blowing on a fire if someone's pouring petrol on it. You need to stop the petrol getting onto the fire to prevent the problem. Similar thing here. There's no point controlling the symptoms, icing, resting, if the root cause is weakness and that weakness isn't being targeted. But it's a common stage of rehab. It's just part of the ACL rehab journey. It doesn't mean it's a disaster. If you're dealing with it, you're going through some anterior knee pain, don't ignore it, but don't worry about it too much. Adjust the load, rebuild the quad, and control the progression. If you want a step-by-step criteria-based program so that you know you're progressing safely, you're not pushing it too far, you're not holding back too much, I've put a link to my ACL Recovery Roadmap in the description below. So it's there if you want a little bit more support. After ACL, the quads reduce in strength really quickly. You can lose up to 30% just in the first week alone. And if you want to hear more about that, you can watch this video. See you next time.